We've heard a lot about how testing for coronavirus antibodies is essential. In fact, researchers and organizations all around the world have been racing to develop and deliver these tests in the hopes of providing the answers we need to help responsibly reopen our communities. Serology is the scientific study of serum or plasma, especially with regard to the body's immune system response. So serology tests for SARS-CoV-2 can help identify if you or a loved one have been exposed to the coronavirus and have potentially developed an immune response to the virus. Serology tests can potentially have a big impact on public health with regards to the coronavirus pandemic. Since the coronavirus can cause symptoms in some individuals and none in others, it's not easy to determine who's been exposed to the virus. But it is important for us to know who may have developed an immune response and can safely go back to work. For those who haven't been exposed or developed an immune response, the tests tell us that they are still at risk and could potentially be first in line for a vaccine when available, and must continue to be careful about becoming infected. Serology tests detect and measure the level of immunoglobulins, or antibodies made by the immune system to fight antigens such as bacteria, viruses, or other microorganisms. In the case of SARS-CoV-2, the virus that causes COVID-19, serology tests can detect if people have an immune response to the coronavirus. You may have heard of serology tests called IgG and IgM, and you may be wondering what these are. Immunoglobulin M, or IgM antibodies, are the body's first line of defense, and they are produced shortly after someone is infected with a virus. IgM antibodies don't stay long in the body. However, a few days after infection, the body produces immunoglobulin G, or IgG antibodies, which are sustained in the body and, depending on the virus and individual, could last from weeks to months to years. Since coronavirus is new, we don't know yet how long immunity will last. The more we know about COVID-19 and the virus that causes it, the more we'll collectively be able to manage it. Since many people carrying the virus are asymptomatic, it's essential that we rely on clinical tests to help provide a clearer picture of who has potentially developed immunity against the virus and who is still vulnerable to it. This is why Beckman Coulter is strongly committed to the fight against COVID-19. We know that fighting the coronavirus drives you. Delivering high-quality, sensitive, and specific assays drives us. To learn more about the steps Beckman Coulter is taking in the fight against COVID-19, visit beckmancoulter.com/coronavirus.